Good morning and welcome to the new edition of Dr. Lamba's Awakening Call. We always, by we I mean the people living in Canada, the Canadian citizens, and we always pride ourselves because we live in one of the best countries of the world. But what is really the best about it? It's a great country with beautiful sights. It's a great country with hardworking, honest people. It's a great country with people who have capability to work hard and to achieve results. It's a country which is insulated by seas and oceans and protected by USA. And they say the quality of life is among the highest. Is it really so? If we look at the facts, the latest report by none other than the Canadian Institute of Health Information shows a shocking picture. And that study, when I read, I remembered Alexander Pope, who said, whatever is best administered is best. Before I take up the report, let me see what the usual condition is. A country where the unemployment is 9%, possibly the highest in the OECD countries, which are developed countries, organization of economically developed countries. Highest, 9%. And then on the top of it, Canada is getting more and more immigrants, and now they're increasing so that the voters can increase. The vote banks can be there, which can be exploited with politicians. Health facilities, people have to wait for years together to get some normal surgeries done. And now comes the worst thing. Out of the 16 OECD countries, the highest number of coronavirus related deaths in elderly care homes is in our Canada. Can anything be more shocking? That Canada ranks worst in elderly care homes. What a shame. 81% of COVID-19 deaths in Canada, 81% were recorded in the long-term homes. And that is the result not of an independent body, but of a government agency. The government has no shame in admitting that 81% of the total deaths in the country are in the early long-term care homes. And what's government doing about it? Nada, nil, zilch, nothing. And this is, as I said, highest in the 16 OECD countries. For example, now, the total average for the 16 countries is 42%. I understand that elderly people have less immunity. They have already been deprived of the essential vitality of life, and most of them have lost the will to live even. But imagine, just imagine, we rank the last behind Spain, and while we are 81% of the deaths, Spain has 66%. So the gap between the last and us Canadians is itself too obvious, too telling, too clear. Israel and Norway are at 58%. Ireland is at 56%. Belgium is at 50%. France at 41%. And then the Canadian leadership and the politicians never tire of criticizing our neighbor South. USA has the least number of the deaths in the elderly care homes, 31%. Compare 31% of USA with 81% of Canada. And that is by itself clear and needs no commentary. And then, the shock further deepens, its intensity is enhanced when we see that Canada has a relatively low overall COVID 19 mortality rate compared to the other OECD countries. So while our total mortality rate is much lower, the mortality rate in the elderly care home is at the peak. However, I would not deny that the proportion of the deaths in long-term care, which include retirement homes, is, as I said, double than the OECD average. The average is 42%. We are at 81%. And this is based, as I said, on the data collected from 25 countries, 17 countries who constitute OECD by a government agency, Canadian Institute for Health Information. Now, look at Australia, Austria, Slovenia, which do not boast of high quality of life vis-a-vis Canadians do. But they implemented specific preventive measures which are specifically targeted at the elderly care homes. They segregated units and wide screening for the illness. And thereby, the result was fewer COVID 19 infections and fewer deaths. On the other side, what Canada did, it took more limited measures, and then not only did we talk, we were careless. Our measures were either half-hearted or going all the way. The report confirms what we have suspected all along, that Canada doesn't care for the seniors the way it should. It takes them as a burden. When I say Canada, I don't mean you and me. I mean the authorities that be, the government. And this has been admitted by the Prime Minister himself. But what has he done? What happened in Quebec and Ontario? There was a chronic shortage of staff, which was worsened by the pandemic. Now, the first question is, if in a country unemployment is 9%, and then we say there's a chronic shortage of staff, then something is wrong with our planning. That means our education system is also not geared to the employment, or efforts are not being done to train, retrain, and reskill people for the jobs. So what had to be done? Army had to be called in to care for seniors at long-term facilities in two major provinces, Quebec and Ontario. Imagine the situation was so drastic. After all, 81% of the total deaths is not something to be sneezed at. So army had to be called for to protect and give help to the seniors at the long-term facilities. And because there was a chronic shortage, which shows poor planning, poor foresight, and carelessness on the part of the government. As a matter of fact, heads should have rolled. And the prime minister, who is already plagued by corruption charges, should have resigned. Or he should have dismissed the premiers, which he can't do, of course. But he could have taken action, strong action, which he did not. The report further notes that the proportion of seniors aged 65 and above living in care homes in Canada is higher than the OECD average. Why? Is it because the government is not giving them the facilities? And they tend to be older on average too. They are older because of clean climate. If they are having a longevity of life, it's no thanks to the government. It is a boon of living in a pollution-free natural surroundings. But as I said earlier, there's understaffing. We have fewer nurses and personal support workers per 100 residents, senior residents, compared to the other countries. As I said earlier, this shows absolutely useless planning, ill planning. Then there's another issue. The report points it out very clearly that there are different testing and reporting standards across countries. A, the testing here is absolutely not up to the mark. I posted a tweet by Elon Musk yesterday. He was tested 4 times in one day. Same place, same nurse, and 2 times he was tested positive, 2 times he was tested negative. I agree it was in USA. But what's USA is worse here in Canada. I'm sure that if I was to be tested again, I would be tested positive. I might have been tested negative the other day. But my grouse today is not with the testing. It is with the government policies and total disregard for the lives and the comforts of the seniors, especially those seniors who are living in long-term care houses, who have nobody to tend after them, to look after them, either because of the cultural factors or because of the economic factors. And the government is failing absolutely in protecting the life and the limb of those people. When the mortality rate is double the mortality rate of other advanced countries, that's a matter of shame for the country and a shame for the government. Canada has failed miserably, absolutely miserably, on the economic front with a higher unemployment rate. It has failed miserably on health front. We have seen the wait times in the hospitals, emergencies, surgeries being obnoxiously high. And now this total disregard for the life of the most vulnerable section of society. Imagination is shattered. You can't imagine except to weep for these people who have the misfortune to be the long-term home and a feeling of disgust for the government. and for the authorities that be. And we find that there's nary an expression of regret over all this. I've seen not a single statement from any premier, either of Ontario, except or of Quebec, and they have always been adding more and more problems to the lives of the people by lockdowns and things like that, which is not helping. The ICUs now are falling behind the required number. And if the third wave of coronavirus comes, that might be really wiping out the retirement homes and the long term care units. Maybe that's a secret wish of the government. I can only say I'm angered and disgusted. And my sympathies are with the people who are living in these long term homes, uncared, unhonored, and who make the exit from life unwept, unsung. Such a sad state of affairs. And then we pride ourselves on being one of the best countries of the world. Shame on the administration. Thank you.